Social prescribing is a really exciting way of being able to meet the whole needs of patients within the NHS. We found that actually 1 in 5 patients is going to the GP with an issue that is non-clinical, and actually the GP is not always best placed to meet the needs of those patients. So you can now refer those patients to a social prescribing worker, and they will help to support them around the other elements of their health. So that might be relating to housing, it might be relating to employment, it might be relating to trying to tackle loneliness and other things that have been proven to really make a difference to people's health and well-being. Social prescribing is all about relationships and collaboration, and whether that's actually building relationships, social prescribers building really good relationships with patients that will make a difference, but also building relationships across our system. This is something that could transform the way that we work with communities and local people. So taking the community-based services and voluntary groups and seeing the impact that they have on health, linking them up through the social prescribing into primary care and all the excellent work that's going on there around people's clinical health, and also bringing in the local authority too around housing and economic development, employment issues. So actually starting to knit things together rather than things all being separate in silos, actually starting to look at things as a whole in a place-based way. Really exciting opportunity. I think some people are still questioning the value of social prescribing. There's still some hesitancy around that, or maybe feeling that the support services that social prescribing offers should sit elsewhere in the system. We've been working on this agenda for 5 years now, before some of the NHS work started, and we've really seen that actually a lot of vulnerable people go to the GPs, it's their first port of call. And so actually by embedding social prescribing in the GPs, that kind of holistic support, you're really reaching people who otherwise it would be very difficult to reach, and starting to support them to really see their health issues tackled. So for the last 9 months, I've been privileged to be the Regional Learning Coordinator for the North East region for NHS England. And that's given us the opportunity to bring together all of the new link workers in that region and help them start to understand some of the issues that they're going to face, how to embed well into the GPs, how to really start to support people across our area where there's really high levels of health inequalities. We're excited about the possibilities of training a new workforce that's going to really meet the challenging demands of our region.